Hey everybody, welcome. Welcome back if you're a returning visitor. I'm Debbie and I talk about gadolinium deposition disease, gadolinium-based contrast agents, and pretty much anything related to gadolinium. I'm a patient, I'm not a doctor, I don't give medical advice, and I always encourage everyone to work with the medical team because healthcare is complex. But I do want to talk about today is neurogenic bladder. It's fairly common, and at the urging of my husband, I went back to a urologist and met with a urologist today, and they're going to do some scoping and take a look and see what's going on. But 2019, shortly after my 4 injections of gadolinium-based contrast agent between 2016 and 18, I was diagnosed with neurogenic bladder, and it's just gotten worse and more problematic. And it really has to do with can have to do with incontinence. It can have to do with spasms of the bladder muscle, all kinds of things. But one of the reasons and root causes that they talk about when you read on it is that it can be associated with nerve damage. And that was an interesting thing that we had a dialogue today about, because he asked me how I first was diagnosed, and I told him I was diagnosed early on after the injections, and I was going for chelation, and we were doing full workup on everything, and I was having a lot of burning and a lot of problems, and they thought that it was nerve damage, because all the small fiber nerves in most of my body were on fire and burning at the time, and so they thought it was probably induced by that. And the goal was they hoped it would get better, but I'm 8 years out now, and it's just gotten incredibly worse. Makes traveling difficult and all kinds of things. So I thought I'd mention it. It does seem to be a problem for some people who are injected with gadolinium-based contrast agent. We talk about it in the group, and women especially, it seems that there's a burning sensation and incontinence going on, and why there isn't any cure for it. They can do lots of things. So I'll keep everyone posted, but if you're having problems and you've had an MRI with contrast, check it out. Maybe there could be an association that just unfamiliar with. Talk to your doctor, and hopefully they can do something to help you. I haven't found anything yet, but I will report back when I do. Take care. May your journey be one of wellness always. And if neurogenic bladder is a new term to you, and you've had a gadolinium-based contrast agent injection, see if the dots connect. I don't know. I don't proclaim to be an expert, and I'm not a doctor. I'm not giving medical advice. I'm just sharing information, raising awareness. Take care. May your journey be one of wellness always. Talk to you soon.